Hi, welcome to Science of Living. I am your host Meghna. Today I'm thrilled to share my expertise with you guys to achieve your optimal oral health. Finally, after all these years of experience, I now finally have a chance to reach out to a larger audience. By end of this video, I am sure that you will know the absolute significance of prioritizing your oral health. So when I talk about improving the health of your oral cavity, you might think of having a very fresh breath, shiny, bright teeth, and cavities to some extent. But I can assure you that our oral cavity is much more than that, and it is very well connected to all our other parts of the body. For example, the mouth is very well connected to your throat, mouth is very well connected to your ears, to your brain, and finally, the good and bad bacteria inside our oral cavity, that is mouth, is very much well connected to good and bad bacteria inside our gut. So now let's categorize ourselves into three different categories. Category 1, where you're brushing and flossing twice a day, visiting your dentist on time, using mouthwashes, anti-sensitive toothpaste and so on. Category 2, you're brushing and flossing or just brushing once a day and you are not very mindful of those actions, and also visiting dentist only when the need arises. And category 3, when you are not paying much attention to the oral or brushing habits, you're not very mindful, you're just doing it as a part of your life. So now you already know which category you belong to, and if you're thinking you have to switch to category 1, which is also not right. So let's understand what is present inside our mouth so that we can take better care of that. So starting with your tooth, maybe your gums, maybe your bone, also your saliva or spit you might call, and also the good bacteria and bad bacteria. Now, saliva is the hero of our mouth. That is, saliva is the major key role player of our oral cavity. Now, there is something called as pH of saliva. So, our goal is to maintain the pH of the saliva. If the saliva is good, then our oral cavity is good. We will not fall into any major problems, including your caries. Also, listen to this, sugar does not cause cavities. There is no one specific food that causes cavities. The bacteria inside our mouth, those feed on the carbohydrates that are converted into the sugar, and those are the things which are causing cavities. Okay, so now let's talk about our gum health. Gum health is very important. If you're having some kind of infection in your gum, if your gum is bleeding while brushing, if you're having inflammation in your gum, then you should go really visit your dentist, because the bacteria in the gums can really reach to the roots and the roots of the tooth, and worst case scenario, it can also enter into your blood circulation, causing a disease called Alzheimer's. Now, Alzheimer's is a neurological disorder. So Alzheimer's is usually a common form of dementia, which is affecting the thinking, memory, and behavior of a person. So now this is not the sole reason of causing the Alzheimer's, but there are also symptoms like plaques, which is spelled PLAX, that is these abnormal fragment of proteins which are forming inside the neurons inside the brain. These are the things which are related to the infection in the gums. Now, I have made a list of things which are good and bad for your oral cavity, starting with your bad things first. First is alcohol. Definitely, alcohol is not good for your body. I'm not saying don't drink alcohol, but then taking care of your oral cavity before and after drinking of alcohol is very important. Like, alcohol dehydrates the oral cavity. So hydrating yourself very well before and after drinking of alcohol is definitely good. It helps to keep your oral bacteria in place. And also, coming to citrus food is not a bad as such, it is very good for health actually, but when consumed in proper portion at a proper time is very important. You can probably have citrus food in the middle of the day, as the saliva is most in action in the middle of the day. Your acidic drinks, I'm not a fan of acidic drinks. It's a big no. It alters the teeth structure, it washes away your tooth structure, and it dehydrates your oral cavity. So definitely, and it has a lot of sugar, so it's definitely a big no. also coming to your some kind of drugs or stimulants is also very bad for your body, especially the oral cavity. But when it's prescribed from a doctor for a specific condition, then good, you have to take them, but you cannot stop taking care of your oral cavity as well. So probably make alternative changes in your diet, keep yourself hydrated, and eat mindfully while taking those medicines or stimulants. Caffeine is also a not very great idea, but also when consumed in proper portion and properly, probably once a day should not be a difficulty in managing the oral cavity. Also, the brushing habit, hard brushing habits are no, big no. So, brushing your teeth very hard, brushing your gums is not good for your oral cavity. Coming to the good things which are good for your oral cavity is your intermittent fasting, definitely. So when you do intermittent fasting, I'm not promoting intermittent fasting, but people who follow definitely know the benefits of intermittent fasting. So you're having your first meal in the middle of the day around 12:30. So it is definitely good. As I told you, the saliva is most in action in the middle of the day. So definitely intermittent fasting adds benefits in keeping your oral microbiome in place. And eat a balanced meal. I am stressing on this. Please start eating a balanced meal. Proper protein, proper portion of your fibers, carbohydrates is very important. Also cheese and dairy products are very good for your teeth. Please make a habit of having a cube of cheese every day. That keeps your oral cavity very well. And soft brushing, use a soft bristle brush and change your toothbrush every 3 to 4 weeks. That is very important. Now coming to your tongue. Now tongue, maintaining the hygiene of the tongue is very important, which we normally forget. But we brush our teeth, we floss maybe, but the tongue hygiene is also very important. Scraping of tongue is generally recommended, or brushing of the tongue. But if you are planning to brush your tongue, I would suggest use two different toothbrush. One for brushing of your teeth and one for brushing of your tongue, just to avoid the cross contamination of bacteria from your tongue to tooth. So change your brush every 3 to 4 weeks, as I mentioned. Some information on treatments of your teeth. We can start with the preventive treatments like fluorides and sealants and so on. Also, the treatment of your tooth varies from fillings to root canals depending on the severity of your cavities. And then comes your later stages like gum surgeries and tooth surgeries as well. Now, sticking to your basics is very important with the daily routine. So brush your teeth twice daily. Use a soft bristle toothbrush. An electric toothbrush can also be used, but I would not recommend the use of electric toothbrush for children who are growing or in the developmental stage, as it is important for them to use a manual brush for the development of their motor skills. But adults may continue to use electric toothbrush. Use a fluoridated toothpaste. Eat a balanced meal. Scrape your tongue. Brush your tongue nicely. Maintain a good, nice oral microbiome of the oral cavity. Now, I know these are very simple steps to take care of your teeth, but when practiced mindfully with a regular routine will help you save from lot of diseases. I hope this video will bring difference in your regular practices starting today. Please share and subscribe and follow us for more. Thank you.